So hi again, everyone, or I guess I'll say good afternoon at this point. It is indeed an honor and a pleasure to be here and to be invited to participate during our School of Public Health Alumni Series, Spotlight Series, I should say. And so I'm going to talk to you today about your role in pursuing health equity. What does it mean to be devoted to tackling health disparities? And I apologize in advance if my now 3-year-old dog decides to to make an unwelcome appearance during today's talk. But so in general, I will let you know a little bit about myself. So I am a 2012 alum of the School of Public Health, and I am currently working as an assistant professor with a primary appointment here in the Department of Epidemiology. But I have joint appointments in a few places, including within the Department of Surgery, Health Policy and Management, and Health Behavior and Society. And I also serve in two leadership roles here at the school. So I am one of the associate directors of both the Urban Health Institute and the Center for Health Equity. And I will tell you a little bit more about what I do in a minute. So first, just as a reminder, we're in the middle of a pandemic, right? And so this is our COVID-19 dashboard that is housed right here at our own university, and has really been a saving grace for the whole world in terms of how well we're doing, or I guess how poorly we're doing. The punchline here is that things are a bit of a mess, and we have a long way to go if we really want to improve the state of affairs for the world, and more importantly, even for the United States, which I'm sure many of you have heard, the really unfortunate news about the number of deaths here. So one of the things that I often like to do is to, really just to give you a picture, because as we know, a picture is worth 1,000 words. And so let's go to our great friend Google. And this was just this morning. I just literally Googled COVID death. And we can continue to see that, we are being really hard hit here in the US. I did not specify which nation, but as you can see, the top 6 hits, that among the top 8 hits, at least 6 of them were centered right here in the US. And so, again, just really speaking to the magnitude of what a public health crisis that we are currently facing. I also Googled just health disparities, right? Because that's what this talk is about. And some of the things that sort of popped up under the news category was talking about, the fact that disparities persist as the US tops 500,000 COVID-19 deaths, really thinking about other things like climate change, in case you haven't been paying attention to the weather and all that's been going on. We know that the Biden administration has announced that there will be a focus on health equity specifically, and things that we need to do in order to achieve this. And we also know that there are, dual crises happening, or at least two, I'll say. Not only are we facing a pandemic as it relates to COVID-19, but also these very overt acts of racism have really come to the spotlight in so many conversations around what we can do in order to address that. And now that we are in the midst of, really trying to have a big push in terms of getting people vaccinated, unfortunately, we also see that there's a disparity in terms of who's getting access to the vaccines. As I mentioned, we know that racism is really something that has been in the national and international media, especially over the last year. There have been very overt acts of racism, and people have really, at this point, really been able to definitively say that it's time, it's beyond time that we address many of these things. And as you know, these have real clear implications, even for the field of public health, especially now as we are thinking about vaccines and other life-saving treatments, and what that means for communities who are afraid that their lives are not valued on the same scale as others. And what does that mean in terms of our public health messaging and those that communities view as trusted agents to really get the word out? So again, we have lots to do. But this did not just start in 2020 or even, in 2021. How did we end up here? And so really what I'm describing, and I'm sure you all know, but just to ensure that we're all on the same page, I'm describing a persistent state of health disparities, which, we've probably recognized for as long as we've had national data on just about any health indicator. And so one definition is that health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. And where we want to go is a state of health equity, where every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. You've also, again, heard all of the different ways by which we often describe different types of racism. We know that when we really are thinking about the role that racism plays in terms of health disparities, in terms of disparities in healthcare access and outcomes, we're not just talking about interpersonal racism, which is often what we see on the television, meaning the interaction between two people. What we are describing is a system of racism, so systemic racism. And one type of racism is structural racism. And this could be defined as mechanisms by which societies foster racial discrimination through systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice that reinforce discriminatory beliefs, values, and distribution of resources. And so one example of this is when we think about the fact that often, with many of our maps or with much of our data that we describe, we often talk about neighborhood level differences or zip code level differences. But when we think back to why our neighborhoods or why do our cities look the way that they look, including right here in Baltimore City, we have to think about what has been the role of different policies over time. One of these such policies was the legacy of residential segregation, including the practice of redlining. And so this was quite literally banks were allowed to draw red lines around portions of a map to indicate areas in which mortgage lenders did not want to make and were not required to make loans, for example, to Black or African American families. And so again, if we look in many of our major cities, including again here in Baltimore, we still see very stark segregation by race, by income, by lots of other metrics that we know play a major role in terms of what happens to people and their abilities to attain optimal health. So this is a talk that is based in the School of Public Health, even if it's virtual. So we have to think about our different frameworks, right? So one is the social ecological model, which I'm sure that you all have heard about. And in the field of health equity and public health, what we often like to do is to remind people that, addressing health disparities is not one problem. It's a bunch of problems happening at multiple levels. And so, because of this, we have to think about how do we tackle multiple factors that are driving these disparities in order to achieve a true state of health equity. These levels include the individual patient level, family or social support, the provider or clinical team, the organization or system level, the local community or neighborhoods, and then also our national and state health policies that may or may not worsen or even improve disparities over time. And so we have to think about the role of all of these factors in how they each can manifest in different ways to drive our disparities. I never like to leave people with just woe is me stories and just bad news. I always like to talk about what can we do about this? What are potential solutions? And again, in the spirit of Black History Month, one person who immediately comes to mind is Congressman John Lewis. And so these are three quick quotes when we are thinking about what are potential solutions, what is my role in really trying to drive necessary changes. The first quote: When you see something that is not right, not fair, not just, you have to speak up. You have to say something. You have to do something. The second quote: nothing can stop the power of a committed and determined people to make a difference in our society. And then finally, get in good trouble, necessary trouble, and help redeem the soul of America. And so, again, as public health champions and advocates for justice and advocates for the health of the communities that we serve, we have an obligation to do something about this. Some of the ways by which I've tried to devote my career to doing something about this is really helping to build targeted efforts in order to achieve health equity. So much of this is focused on my research. So this is a paper that Dr. Lisa Cooper and other colleagues and I wrote in Health Affairs, and it was published in 2016, where we talked about the fact that we have many gaps in the field currently. And in order to truly achieve a state of health equity, we have to think about ways that we need to close these gaps in disparities, in the interventions that we develop, and in future research. And so the figure on the right is, again, a figure that's sort of adapted from the social ecological model and thinking about a multi-level framework. And the punchline here is that we cannot function within a bubble. We need to engage key stakeholders in a meaningful way. And we need to work at multiple levels to really target multiple factors all at the same time if we have any chance, any shot at addressing health disparities. And so these are some of the examples of some of my research and community outreach projects that are currently ongoing. I do a lot of work as it relates to kidney transplantation and really trying to improve access to transplants for patients who have end-stage kidney disease. We know that this is a condition that disproportionately impacts African Americans, other, Black Americans, or even those who are, again, descendants of the African diaspora. We know as well that other groups, including the Hispanic, Latinx community, and the indigenous populations here, are also disproportionately impacted by kidney failure. And so what I try to do is to take a a multi-angled approach, including I examine large national registries and other survey data to look for potential points of intervention. And then I partner with patients, their family members, and other important stakeholders, including faith and community leaders, to try and develop new ways to tackle the factors that are driving these disparities. We know that COVID-19 disproportionately impacts the same communities that already had major disparities in pretty much every other condition. And we know that it's very important to engage, again, trusted agents. And so another project that I'm working on now is actually partnering with about 50 African American faith leaders here in Baltimore. And we are working to conduct a survey study and to develop a novel educational curriculum that really will help us to address COVID-19 concerns among the faith community here. In addition to this, we know that it is important to really think about what are the tailored and local needs of our communities. And in this spirit, we have another faculty member here, Dr. Jean Charleston, who started, I guess, about 20 years ago now, a program called Health Freedom Path to Wellness. And this program, the beauty of it is that it actually uses the legacy of the Underground Railroad and the fight for freedom and civil rights to really help to inspire and motivate community dwelling adults to really improve their cardiovascular health. And about a year ago, I answered the call when Jean asked, and I took over as executive director of this program. And so currently we have a Google funded study where we are creating a mobile version of this program. In addition, which I'll talk about in the remaining slides, as I mentioned, I have multiple leadership roles, and many of this actually involves educating and training the next generation of health equity scholars, and also doing outreach work that involves multiple stakeholders, including members of the community, policymakers, and anyone else, frankly, who can help us to move the needle on addressing health equity. So, because we know that COVID-19 disproportionately impacts many of the same communities that we were already trying to help with the other conditions, many of us who I guess were sort of labeled as health equity experts were also asked to sort of come to the proverbial front lines when it came down to trying to think about what can we do to sort of tackle what was happening within the context of COVID-19. And so in my case, that has involved also, speaking to members of the media. So, some of the places include here within the Baltimore Sun, but also within national media, including the New York Times and the LA Times. I see my good friend, Dr. Tia Zeno Brown here. And so this will be a shout out to her and her native, Louisiana, as well as my native, Mississippi. And so really thinking about how can we provide guidance and advice and really just really helping to move the agenda based upon what we've learned in terms of tackling disparities more broadly. And then most recently, last week, I was here on one of the local radio stations here in Baltimore, WEAA, where I was asked to participate in a vaccine hesitation conversation series. And really, I just answered questions that were submitted by members of the general public. In addition, so here at the Center for Health Equity, for which I'm one of the associate directors, we have lots of different educational and training initiatives, including monthly seminars, which right now are virtual and open to the public. So we have pretty much, I think, based upon November 2020, the last count was over 7,000 attendees for our health equity jam sessions and special events. We have 2 courses here in the School of Public Health, one in the 3rd term ongoing now and one in the 4th term, both focused on health equity research methods. And we also have 2 courses that are available to the general public on Coursera. So this is a massive open online course. In addition, we have a tailored mentoring program here where we actually pair up trainees with potential faculty mentors. And the photo that you see in the bottom right corner was from one of the very first offerings of our course, which actually began, I believe, in 2017. And so, as I mentioned, we have 2 courses available to the general public. And in case these are of interest to you, you can find them on Coursera. These are the titles. We just launched these courses in 2020. And so far, we've already had over 3,000 people who've taken the courses. I also see my dear mentor, Dr. Janice Bowie here, and she is one of the featured instructors for the course. Now, I mentioned to you that much of my work in terms of research has focused a lot on kidney disease, transplant, et cetera. Part of the reason why is because there was a need. There was a need for more people to answer the call and help do something, right, about it. Once you see something, you do something. One of the things that we saw and that we know from a few years ago is that we lost one of our very own, Dr. Shalon Irving, and we've lost many Black mothers to something that is really, frankly, preventable. It is a disgrace, and it is something that we all need to do something about. And in the spirit of doing something, a team of us right here at Hopkins, along with many of Shalon's classmates, her mother and her daughter, we all sort of came together and really helped to pull together a special symposium on the topic of maternal health equity and really thinking about ways that we need to bring all types of stakeholders to the table to really move the needle on racial disparities in maternal health. Since that time, and not, a direct consequence of just our work, but the work of many, including our own Congresswoman Lauren Underwood, there's now a maternal health caucus in the US House of Representatives. We know that Shalon's mother, Mrs. Wanda Irving, and her close friend, Dr. Reagan McDonald Mosley, have started a nonprofit in her honor. There have been, new bills that are being proposed, new policy changes, And more importantly, one of the great things about this particular symposium is that we were able to hand the mic over to people who were already doing the work even before this ended up on the national radar, and they continue to do the work. And so, this is just an example of how we all have an obligation to say something, to do something. Maternal health equity, as you know, as I've told you, was not my primary area of research, but tackling any factors that are driving health disparities more broadly is something that I'm devoted to doing, and something that I hope you are devoted to doing, no matter what role you play in society. And so just in the last, I believe 3 slides, we'll just talk about your role in pursuing health equity and what it is that you can do. So first of all, and last of all, it's not up to me to tell you what it is that you can do or should do. What I will tell you is that now that you know, now that we've talked about the factors that are driving this and a great need, you have an obligation to jump in this game and to do something. I was an undergraduate computer science major. My degree is in computer science. But when I learned about health disparities, I knew I had to figure it out. I had to jump in this game. And I hope that that's something that you also will walk away with. And just in the spirit, again, of honoring so many folks who are health equity champions, I'm here, just to give the talk on behalf of so many doing the work. But it is indeed my honor to even recognize other alumni of the School of Public Health. Again, in the spirit of Black History Month, I decided to really highlight several Black women who are doing amazing work in multiple fields to promote health equity. Dr. Bowie, I hope you see yourself on this slide. And this is another slide where you see, lots of amazing people. Tia, you're here, lots of other folks who I can't see right now with my screen being in full. But basically, as you can see, the last 4 squares have the letters YOU and a question mark. So if you're not already in this game, there is a space for you. There is need for you to be innovative, to be brilliant, to bring your full selves, your talents, your skills, and just be willing to jump in. And the last thing that I'll leave you with is 2 quotes from our own Dr. Shalon Irving. I see inequity wherever it exists, call it by name, and work to eliminate it. I vow to create a better earth. And finally, equity is an actual, tangible possibility and not mythical like aliens and unicorns. It is real, and the time is now. Hashtag equity now, hashtag do better. So that is all I have, other than, just sharing with you my team's email address, Purnell_research_team at jhu.edu. If you would like to connect on or have ideas about potential collaborations or ways to serve. And thank you very much for your attention. That's all I have.
Thank you, Dr. Purnell. We will open for questions now. If anybody has one, feel free to unmute and ask. I've also thrown some links in the chat for either articles or websites that Dr. Purnell referenced.
Thank you.
We just had a question come through the chat.
Oh, perfect. Okay. Hi, Lindsay. So wonderful to see you here. And thank you for your comments. Oh. Yes, there will be a recording, right? And we'll be able to share it with our colleagues, right?
Yes.
Perfect. Others, I don't know, not to pick on folks, but Dr. Bowie, are you here? Are you available to say hello to the crowd?
Hi, everyone. It's nice to be here. And I said to Tia, I said, Dr. Purnell has called us out. So we were planning to be called out. We were just planning to listen. And but, everything you just said, Dr. Purnell, or Tangela, or as I call her, Tangi, everything that you just said, I think just really highlights this moment and space that we're in, and that there is a role that everyone can play. And, and I didn't realize that you were going to put up Shalon's quotes at the end, and I was hoping not to see, because every time we talk about Shalon, we all get kind of teary and choked up, because her death was one that really should never have occurred. And there is no question that, that her death occurred because, as an African American woman who was well educated, who held a high position at the Centers for Disease Control, was in the public health service, was not listened to, and was told that her symptoms were just, kind of all in your mind, sort of what she was to expect as part of her postpartum, and she was dismissed. And the reality is that hers is the story that was reported and that we get to tell. But the other stories, the unknown stories, the unreported stories, the women and people who are less regarded, are the ones that I think Tangela and all the women that she showed on this list are really fighting every day to try to change this paradigm, to try to help people understand and value the lives of all individuals. And, yesterday I was fortunate enough to receive my vaccine. And, as I was there with my husband and thinking about the people who were waiting in line, and I also thought about how the system to receive vaccines is so chaotic and confusing for so many people. And I also thought about how we can do a whole lot of things, but it seems like when it comes to Black and Brown people in particular, we can oversample them in our studies, but when it comes to trying to overdo what's necessary for people to be vaccinated, we get the same sentiment that people are hesitant or they don't want to receive the vaccine. But it's like part of the story. And if any of you ever have read the Bible, or you've been to church or to your sacred space, and the pastor says, wives, obey your husbands, they seem to stop there, right? And this is the same kind of thing where, my husband tried to run that game on me, but it did not work. And so, just as a side, but why I'm using that as an example is the same thing that's happening in this vaccine space of hearing, participation is low among Black and Latinx populations. And again, the fault and the blame is being put on people, not trusting, not wanting to get it. And while, yes, that may speak to a portion of the population, but I'm saying, tell the whole story. The whole story is that if you don't make the service available, accessible to people, and put the service in places where they can get to, then you will have less participation and greater hesitation, because people will again say, well, you see, it's the same as everything else. You're not really trying to make sure that we are included. When you look at the rollout, your name you first need some electronic device or cell phone to register. I registered and then was bumped right out of the system. But I had the means to do it again. When you call, you got to go through a menu of about 15 different sub-menus, and then you get to the end and you still don't get a person. So I appreciate what Tangela has said and calling on people like John Lewis and others that say, when you see something, you say something, you do something. So that's what I've been doing. I've been saying, you know, hey, don't just tell half the story. And one of our local representatives, so, you know, I'm usually in Baltimore, but right now I'm in Virginia, I'm in Richmond. And one of the local city council people here has called out CVS. And called out CVS because, you know, it is one of the partners in administering the vaccine. And they chose certain stores, certain locations, but they overlooked some of the locations in communities, again, of color, where people could get the vaccine. And so he called them out. And I said, you know what? Money is green. Money doesn't care what color you look like or where you come from, as long as when you put that dollar up on that counter, you pay for your item. So my point is that, okay, we don't have to go to CVS. None of us have to shop at CVS. We have Rite Aid, Walgreens, Publix, Kroger, Target, Walmart. If you choose to go there, I don't choose to go there because they have terrible benefits for their employees. So, I'm all over the place, but you get my point of exactly what Tangela is saying here, is that health equity is not a joke. It's real. We see it every day. We have to start making connections. We have to start speaking the truth. We have to start with our own families and our children and ourselves. And, and that's the only way really that policies are going to change, that people are going to change, that systems are going to change. So, I will stop there. I don't even know, Lindsay, if I answered your question, but you can reach me offline because I know you personally.
I felt it, I felt it in my spirit. I knew that you had a word for us, and that's, I think, a wonderful way for us to end. But I also just wanted to recognize, a couple of folks in my journey. So one of my team members is here, Dr. Jamila Perkins, who's doing some awesome work with our COVID-19 study. I see Mrs. Mary Sewell, who is here, and who really is part of the reason why many of us got through our programs.
Absolutely.
Was like, our number one supporter, our number one champion. And as I mentioned, Dr. Tia Zeno Brown, Dr. Lindsay Schwartz, several ones of us who were classmates here together, as well as, again, thanking you, Elizabeth and Erica, for the invitation and for doing this. So.
Can I say one additional thing? What I think is so important, and I think, Janice, you said it so poignantly, in that it's an important now. It's always been important, but I think right now is a time when this connects to every part of public health. And so as we share this with our incredible network of public health leaders from our alumni network and beyond, this is the importance of now, and being able to connect with the center that you have in your slides, and to be able to connect with you to identify those opportunities, those cross-sectional opportunities, to really dive into this and make a difference in whatever work you're doing. So thank you for being here. I do know there was one quick question that Jade, I think you asked about. So maybe you can just answer about that connection, and then Elizabeth, I suspect will want to close this.
Oh, I missed it. So sorry. I started and stopped with the fact she's a fellow Mississippian. My apologies. I didn't even realize there was a question in there. So are there current collaborations between the Center for Health Equity and the Center for American Indian Health? We don't have official research collaborations, but I will tell you that several of us are sitting on different committees together, including the ICTR here at Hopkins has a new task force on how to improve equity in research participation. And so several of us, including representatives from the Center for American Indian Health, are together on the working group on race and ethnicity, and how we can collectively do a better job at this university. And so I anticipate that there could be so many more opportunities for formal collaborations, even in research. And we're also open to ideas. If you have things that you want to propose, let's do it. But we are in the good fight together, I'll say, more collectively.
Thank you so much.
You're welcome.
So I think we'll go ahead and wrap up today's session, but thank you all for attending. And special thank you to Dr. Purnell for the wonderful presentation. And it was so nice to hear from you and to have you all here today. So as we mentioned before, I will share the recording and all of the links that were thrown in the chat with everybody later this week. And it will also be available online for you to share with anyone else in your network who might be interested. So I'll go ahead and stop the recording, and I'll stay behind if anybody has any questions unrelated to the presentation.